This is Dr. Michael Tapper from Infectious Disease Advisor, the HIV Advisory Channel, and reporting to you today from the Infectious Disease Society of America meeting, or IDWeek, which is just beginning today in New Orleans, Louisiana. And I'm joined by Dr. Pablo Tebas from the University of Pennsylvania, who is the chair for this entire session, a lot of material on HIV disease. So Pablo, welcome to New Orleans, and I guess the question is, what's new, what's breaking, what's going to be hot at this meeting about the management of HIV disease?
I mean, in this meeting we have several sessions about HIV and a whole full 3 days of presentations about HIV. But I think the main topics are going to be around new strategies to implement PrEP in the community. So there are several abstracts about identifying candidates for PrEP using electronic medical records, and also how to use better PrEP. Mm-hmm. There is an interesting abstract looking at changing behavior in individuals taking PrEP, mm-hmm. and the risk of sexually transmitted infections in that group. That's in prevention. In treatment, during this meeting we have several studies being presented about results of different clinical trials with antiretroviral drugs, but there is the first presentation of a new HIV drug called ibalizumab. It's a monoclonal antibody against the CD4, and it's going to be presented here on Saturday, and showing antiviral activity in patients with HIV and multi-drug resistance.
So to return to the issue of PrEP, I mean, two issues that have concerned me, and probably have concerned you and others, is the relative, I would say, underuse of PrEP, particularly by individuals who are not HIV-trained specialists or ID specialists. A lot of physicians in the community seem to have a continuing reticence to initiate PrEP. The other issue is most of our PrEP work has all been done using pretty much the same combination of drugs, mostly to date tenofovir and FTC. Any data on new drugs and any additional data on the scale up to get more community-based practitioners to be initiating PrEP for seronegative patients?
In this meeting, there is new strategies to identify patients at risk using electronic medical records. There's a study from Boston. There is a lot of research in new ways to deliver PrEP with intramuscular formulations, longer-acting drugs like cabotegravir. There is no new data presented during this meeting. Most of them were presented in a prior meeting, and I think we will hear more next year about that type of strategy to basically take care of the main problem of PrEP, is that adherence. You have to take it in order to be effective.
Well, we've talked so much about the scale-up of antiretroviral therapy in developing countries. It's mostly been scaled up here, although there's still a percentage of patients who are HIV positive who either don't know it or know it and don't get treated. So now we're talking really about scale-up of PrEP to try to find those people who are seronegative, still having at-risk behaviors, and get them onto PrEP.
Yep, that's the next big challenge.
It's going to be a great meeting, Pablo. Thanks for joining us.
You're welcome.